Hmm. All right. Let's see if I make sure if I'm on here. All right. I think I've got one person on. All right, guys. Sorry about the delay there. There's some technical difficulties going on. Let's see if we can make sure everything's up to par here. Looks like everybody's kind of coming in now. All right, perfect. Well, I'm going to give you guys a couple of seconds here for everybody else to get in that wants to kind of join the discussion today. But we're going to first mostly start with cardiovascular health and kind of go through a nice little presentation here. So again, give you guys just a couple seconds here for everybody else to get in that maybe wants to join. But I appreciate everybody joining me today for on their Saturday here. And maybe we can kind of get this thing rolling in just a minute, okay? All right, guys. Well, I think we'll kind of go ahead and get started. I'm not sure how many more are gonna come, but first and foremost, I want to introduce myself. I'm not sure if everyone knows me or if has seen me at the clinic before, but my name is Cody. I'm one of the nurse practitioners at Welllife Family Medicine. I've been a nurse practitioner with Dr. Ely and Welllife for about 1.5 years now, and so I love the clinic and really enjoy the patients that we have. I think our patients love to make changes to their health and love to be the best advocate for themselves, and so that's really all a nurse practitioner can ask for patients. And so I'm excited today to kind of walk you guys through some hopefully some education on cardiovascular health, and we'll move forward with the presentation here, okay? So we're going to start talking mostly, and again, cardiovascular health is something that I really enjoy discussing with patients. And back when I started with Dr. Ely, he always discussed some things that maybe something that we might have interested in. That was kind of the first thing that I brought up to him. Is just that I enjoyed cardiovascular health in general, and so we're going to kind of talk today about quite a few things, and we're going to discuss in the agenda today, and hopefully answer some questions for you guys about why it's really important to get your heart health checked regularly. Heart health is so important, and we'll talk about ways today that of reasons of why and statistics, and maybe kind of give you guys some better ideas of why you should get checked early. How often you should get checked, making these annual appointments with us, and seeing and assessing risk all the time. We're going to talk about risk factors, so things that may contribute to cardiovascular disease. We're going to break down exactly what cardiovascular disease is, and talk about testing options, talk about treatment options, and hopefully, probably the most important thing is talk about ways that we can actually prevent cardiovascular issues from occurring. All right. And so we're going to continue to go on here. So really, what is ASCVD? ASCVD stands for atherosclerotic cardiovascular disease, and so it's a big topic, and it should be, specifically in the United States. There's a lot around this topic. And one thing before we kind of push further is this is a very broad-based, kind of flat level approach. There's so much information on this topic, and there's no way I can discuss everything about this topic in the span of 45 minutes to an hour. So I really wanted to really kind of give you guys a baseline and kind of maybe help you understand where we are coming from in terms of looking at risk factors. But of course, if you have any questions along the way, make sure you put those in the comments down there, and I'll do my best to answer some of those at the end. But so kind of getting back to what ASCVD is, and I love this definition from the American Heart Association. It really comes down to just the buildup of cholesterol plaque in the arteries. And that buildup can lead to many different things. And so, of course, as far as everyone knows, myocardial infarction or heart attack and stroke, those are kind of the two big ones there. But ASCVD has implications for lots of different things, and so we're going to talk today about ways that that can affect us, but also ways that we can hopefully prevent this from occurring. All right. We're going to sneak through a little bit of statistics here, and it kind of goes back to 2020, and really kind of covers the purpose of why we should study and why you should be getting annual appointments with us for checking cardiovascular disease. And so really cardiovascular disease is the number one cause of death in the United States and worldwide. There's lots of talk about cancers. While those are all very important, and we need to reduce those as well, but cardiovascular disease is still the number one killer. And so we really need to focus on this specifically. There's quite a bit of things that we can do to kind of prevent some of this stuff. So ASCVD actually kills 3 times more people than cancer does every year. Just in the United States alone, about 2,400 deaths per day occur from cardiovascular disease. Heart attacks occur almost every 25 seconds here in the United States. And really, we look at the statistics. This goes back to 2020. This definitely could be increased now, just 3 years later. But this has been going on since the 70s and 80s. Cardiovascular disease has been something that's really been plaguing the United States, and it just shows with the amount of cost that really it hits on our healthcare system. And in 2010 alone, $316 billion was spent on heart disease. And this next slide here, I really like this because it again just kind of shows you a better picture of cardiovascular disease and kind of where it stands in terms of major issues and healthcare issues, and where a lot of our money is going towards in terms of just health in general. So definitely something that we need to kind of address and try to get under control if we can. So we talk a lot about what age you should start looking and getting screened for cardiovascular disease, and I liked this graphic here just because it kind of shows you really not a lot of issues with cardiovascular disease, especially in your 20s and 30s. But the big key I want to show is you do start to see a little bit of a change in your 20s and 30s, and that's why it's really important, and that's why I recommend you start getting in with this as early as you can to get annual lab work done, so that we can start checking these cholesterol levels, which we'll talk about in a minute. We can start checking lab work to make sure that we're preventing these long-term issues that really start to occur, as you see in this graphic, in your 60s and 70s. Cardiovascular disease is a decades-long process. It doesn't typically just show up overnight. A lot of these issues for many of our patients has been occurring for 40 years sometimes. And so, if we can get ahead of the game, prevention is key to anything. And so if we can get ahead of the game and hopefully notice things early, they're much more easily treatable than picking these things up in your 60s and 70s. So So I wanted to add this graphic, this statement, just because I don't want to scare individuals or anything like that, but really, 50% of victims, their first symptom of atherosclerosis or that plaque buildup sometimes is heart attacks, and so the statistics kind of show 55% of individuals who have heart attacks have completely normal lipid panels, and that can sometimes be a scary thing to think about. And so, at Well Life, that's why we try to give you the best option to do extensive lab work and to make sure that we're addressing every single risk, not just focusing more on one thing and putting a band-aid on something, but we're covering the holistic approach to health and making sure that we're covering all kinds of bases in terms of different lab work and things that we can look at. So it's important, and that's one thing I really wanted to stress with this presentation today is come in to see us and make sure we're covering your health and helping you reduce some of those risk factors. All right. In terms of risk factors, there's quite a few. We're not going to kind of go through every one of these risk factors here. But in general, of course, high blood pressure and high lipid levels, high cholesterol levels are always kind of at the top here. I wanted to focus specifically on smoking as well. Smoking is a huge risk factor for cardiovascular disease and heart disease, and it's something that sometimes genetics can even be thrown out the window with smoking. If a patient is smoking, that's something that we want to stop as quick as we can to really reduce that risk. Family history plays a big factor with cardiovascular disease, and so know your family history. When you come in to see us, we should be asking you about family history and just kind of getting an idea of maybe some things that your family has gone through. And so it's something that we can, just the more story we know, the better we can eliminate risks and help you to kind of reach your goals as a patient of ours. And so, of course, there's some other things here, low omega-3 fatty acids. Kind of go over here, inflammation. Inflammation is a big factor for cardiovascular disease, and we're going to talk about ways that we can manage inflammation today, as well as ways that we can test inflammation. Lack of sleep, lack of exercise. We'll talk all about that as well. But as you can see, there's a lot of different factors here, and we can definitely help you make sure that we're addressing those risk factors and hopefully reduce the risk of cardiovascular issues when you are in your 60s and 70s. So kind of before we get going with this here, I wanted to kind of give you guys a broad overview of cholesterol. Hold on real quick here. Having a little bit of issues. There we go. I wanted to kind of give you guys some education on what cholesterol is, and education is so key for my patients. Education is something that every patient should have. There's one person that really can support you and be an advocate for you, and of course that's you. And so you should be your biggest advocate. And one way that you can do that is just to become educated. And so I love to educate my patients when I see them in the office. And I want you guys to be educated after this presentation as well. So what is cholesterol? Well, cholesterol really is something that's very important. Sometimes cholesterol gets a bad rap. We talk a lot about cholesterol being a bad thing, and really every living cell in your body uses cholesterol. If you were to look under a microscope and you would see the fluidity or the way that the cell moves, that's because of cholesterol. Really, cholesterol is something that also helps to regulate hormones. So whether it be testosterone or estrogen, cholesterol plays a huge factor in how your body and your cells work. Without cholesterol, we would not be able to survive. And so the big key with cholesterol, though, is we're trying to reduce these LDL, these low density particles, and the smaller particles for cholesterol, as those play a big factor. But as you see, cholesterol, this is kind of a picture of a cholesterol cell here. Cholesterol is important, and so we need it, but we also need to be very cautious about the types of cholesterol that we do, the types of proteins that we do have. So, again, I wanted to kind of give you an idea of why we look at this this process and why we look at cholesterol in general. There's a couple different types of cholesterol, or proteins in cholesterol. So we talk about LDL cholesterol, which is low density lipoprotein cholesterol, and that can sometimes be known as the bad cholesterol. Talk about HDL cholesterol, so high density lipoprotein cholesterol. We typically check a total cholesterol level. That's all very common, but we're going to talk about this process of building up plaque and calcium in your arteries, and so really it starts with these LDL, these small particles. This is actually kind of a side picture of your artery itself. These are the cells inside your artery moving here, and so how this process works is if you start building up large amounts of LDL cholesterol, sometimes those LDL particles can actually get stuck in the wall of your arteries. And so they oxidize and get taken up by these white blood cells called macrophages. And so when that starts to occur and you get large numbers of these oxidized LDL, you create what's called a foam cell. Now, again, my goal with this presentation is I don't want you guys to think that, and this is a very, very difficult topic to kind of go over in the span of 10-15 minutes. That's all we're going to spend time on, but I wanted to give you guys the idea of why we look at different lab work. And so these foam cells start to get larger and larger, and they actually create damage in your arteries. And so as inflammation rises, as your body's trying to heal itself naturally, you start to build plaque in your arteries. And so definitely something that we want to kind of stay away from, and it typically starts with some inflammation, but also the cholesterol levels. And so that's kind of the broad overview of what happens in your arteries. Again, there's lots of other, it's not just these steps here. There's lots of other things that play factors for it, but just to give you guys a broad example of what happens kind of in your arteries as you start building up that plaque. And one thing I will say, don't forget this takes decades, right? You're not building up plaque over the span of a few months. Typically this starts in your 30s and kind of works its way as you live your life. And so if you've ever been with us in a clinic visit and we go over heart health in general, this is a chart from Cleveland Heart Lab that I always go over with my patients. It kind of shows us the process of why the lab work that we look at is important. And so we talk about oxidized LDL, we talk about inflammation levels and myeloperoxidase. And this chart's really awesome because it shows us how we can measure the progression of some of these steps. These steps that are really important to keep track of and really, again, mitigating risk. Risk is the most important thing that we can look for. And so if we can kind of watch along, we're going to talk about these labs specifically as we in this appointment or this presentation today. But as you see, we do have ways outside of just a standard lipid panel to measure risk and reduce your risk. And so that's something that it's really important to us, and something that we want to again add that just to your repertoire to continue to help your health in general. So ways to monitor ASCVD. This is kind of our starting process. So if you were a patient coming into our clinic, we would start with routine lab work. That's some of the basics for being able to monitor this stuff. So we'll talk about our routine lab work in just a minute. We'll talk about more of our extensive cardiovascular lab work. That's that staging process that Cleveland Labs offers that we can kind of do just as extra, something that many clinics don't do in town. And then we'll talk about imaging options. There's imaging options as well that we can kind of go over. But of course, with routine lab work, this is something that you should be doing at least once a year, if not more often, if things kind of pop up and maybe a little bit more concerning. But standard lipid panel. So this is where we measure that cholesterol we were discussing earlier. So total cholesterol, LDL cholesterol. Again, sometimes that's considered that bad cholesterol. That's that small particle cholesterol. And if you get anything out of this presentation today, I hope you kind of throw out the windows and realize that it's all about the small LDL particles that make a difference. And so HDL plays a big factor as well. But when we talk about risk, the size of that particle matters, and so we want to stay away from those small LDL, and we want to increase our large HDL. And so standard lipid panel is something that we should be doing every year. HSCRP, so CRP is a marker of inflammation. Now it's not specific to any certain area, but it is nice to keep track of systemic inflammation. CRP has been shown to show benefits with cardiovascular health and correlate with risk, and so we'll talk a little bit more about CRP because that's, I believe, a topic that it's not discussed too often, but definitely something to consider. CBC and CMP, those are just standard lab work, annual lab work options that should be done at least once a year, if not more. That just, CBC checks white blood cells, red blood cells, platelets. CMP looks at liver function, which is important for heart health, kidney function, electrolytes, calcium, sodium, potassium, and then, of course, protein levels, bilirubin levels, all that kind of stuff. So really, this is something that, again, is our main starting point. Now, sometimes we'll add a little bit more based off of our interactions with our patients, but this is a pretty common and typical standard approach anywhere you go to kind of take a good look at overall health. I wanted to focus a little bit more on this high sensitivity CRP. It's actually a protein level that's released from your liver, and so if we kind of go back a few slides and you see that LDL particle going into your wall of your artery, inflammation process is kind of kick-started, and so your body realizes that something's there that shouldn't be there, and so the process is it's going to call for help, and so that's what CRP is. CRP kind of is released from the liver just in due to inflammation, and it's kind of saying, hey, we need some help there. So it's a great marker to kind of look at risk for cardiovascular health. It's something that we should check quite often, and the one big drawback with CRP is it can be elevated due to any type of systemic inflammation, whether that be infection. Infection is probably one of the number one causes for elevations in CRP, but also autoimmune issues, any type of systemic inflammation that occurs. And so it is very good to monitor CRP, but it's not the whole picture, and that's what all these labs should show you is, focusing on one thing is not something that should be done. We should be looking at the whole holistic picture. We've been checking lipid panels for since the 1980s, and cardiovascular health has not changed much since then. And so maybe it's time that we start looking at more in-depth options. So I did add some graphs here just to kind of show you through a few studies. If you guys are interested in seeing some more of these studies, I can always make them available to you. We can email you the studies, but just to get a picture of an idea, in terms of heart attack risk, as we see as CRP levels rise, they can be directly correlated with heart attacks, and specifically in men. And stroke risk also plays a huge factor. And as we start to get higher and higher in our CRP, it can really be well correlated with cerebrovascular events as well as cardiovascular health. So, we'll talk about ways a lot to reduce CRP. There's lots of different options. Specifically diet-wise, food's your best medicine. So we'll talk about diet in a little bit, but if we can focus on your diet and make those dietary changes, whether that be reducing saturated fats or increasing fruit and vegetable content, finding foods that you may be reacting with your system, so looking at food allergies, all those factors can play a huge effect on your heart health. Omega-3 fish oils, fatty acids, those play a huge factor in reducing CRP. Of course, supplements like curcumin and quercetin, plant sterols. Of course, smoking is a huge factor for reducing CRP levels. Exercise, sleep, some more in-depth supplements such as grapeseed extract, rosemary, cold water fish. That's where we talk a lot about omega-3 fish oil, and then CoQ10. All these things can really improve and reduce CRP levels. Really, it just comes down to maybe finding something that works best for you. All right. So typically, once we kind of go through that first set of routine lab work, if we haven't done this already, we'll tend to kind of lean to a more extensive cardiovascular lab work. And so, these are kind of the 5 main tests that I focus on myself. There are a few other tests that we're not going to discuss today, but this is definitely something that we can just add a little bit of protection and just making sure that we're covering a little bit of a more broad basis. And so these labs do that for us. And so the first one we'll talk about is oxidized LDL. Again, as you kind of going back to thinking about that slide where those LDL particles get into the wall and they become oxidized, that's the danger. And so this oxidized LDL test that we do, it will actually kind of give us an idea of the protein damage that these cells do. It gives us a relative risk for these cells, and it kind of again allows us to watch the process that may be occurring. This, along with inflammation, is kind of our first look at some of this stuff, and so sometimes we can catch this really early, and if that's the case, we can start mitigating some of that inflammation, and it won't lead to the further process of kind of that plaque buildup. And so this is a really good start in terms of more extensive lab work. The second area we talk about typically is something called L-Plaque2. Again, these labs are all what we look at for Cleveland Heart Labs. Cleveland Heart Labs make a great, give us a great options to help look at different things. But L-Plaque2 is actually an inflammatory marker, and that can be shown specifically when you start building that plaque in your artery walls, and it can be a great indicator for stroke and heart attack. It's just, again, more knowledge is key for us. So if we can continue to look at these options, continue to look at other risk factors, we can paint a better picture of your health and where we need to change. And so the big reason why I like L-Plaque2 is if you do have some plaque and L-Plaque2 starts to show up, it can also give us a good idea of how stable that plaque is. And so with low LP-Plaque2 levels, the big key is making sure we keep those levels down, we keep those inflammatory cells down, and it kind of gives us a little bit more peace of mind that things are moving in the right direction. The more LP-Plaque2 that we see on lab work tends to show the higher risk of maybe a plaque rupture or the increased risk of continued plaque buildup in the artery walls. And so again, just another option to think about in terms of testing. One big thing that I always bring up with patients is an NMR particle count profile. And so a standard lipid panel just looks at, again, those LDL calculated number and HDL, non-HDL. But really that doesn't give us a lot of idea as to what's going on in general. And so what NMR particle count numbers allow us to do is, one, measure the actual number of LDL particles, as well as measure the number of small LDL particles. Again, if we get one thing out of this lab work side today from this presentation, I want you to get the idea of staying away from those small particles. They're the dangerous ones. We want to be closer to those larger particles. And so what's great about this test is, again, it will measure those LDL particles, it will measure those small particles, and so it just gives us an idea of where, just a more exact idea of what we're looking at. And really, even if you start looking at differences here, it kind of give you an idea of how it works. In terms of that 100 milligrams per deciliter, say if that's just your cholesterol level, I take your LDL cholesterol and I look at it and I say, hey, you're doing great. Your LDL cholesterol is 100, and this is what it looks like. But as you see, it can actually be a little bit misleading. You can have good larger particles, which is great, or you can have a lot of smaller LDL particles, and that's not what we're looking for. We're looking for the ability to be able to better manage your risk, and research after research shows that the risk is actually, when we're talking about mitigating risk, it's all about eliminating those small LDL particles. And so I love this picture. It's just a really great option to be able to say, hey, there's much more to the story besides just an LDL-C number on a standard lipid panel. And when we look at, again, we continue to look at research, LDL particle number predicts cardiovascular disease much better than LDL particles calculated themselves. And so it gives us a better idea of is there plaque buildup in those artery walls? Is there coronary calcium starting to develop? Do we need to test for some of that stuff? Do we need to dig a little deeper than just taking a look at more of a standard lipid panel? So, all right, keep going here. Myeloperoxidase is another enzyme that we tend to look at. It's an inflammatory stress marker, and really it's something that it's just kind of all along the process. It gives us an idea of things at a progression stance. So where are you in this process, and how can we reduce some of these risk factors? And myeloperoxidase, L-plaque2, all this stuff can be changed. We see it weekly that guys and girls come in for appointments, and those levels may be high, and we can reduce those risks and reduce those levels and see some changes there. So myeloperoxidase is just another one that's really important, something that we should look at there. And the last one I tend to look at, not too common, but it is something that I sometimes, if we're continuing to see some of these lab work values come back as elevated or not exactly optimal to where I'd like for them to be, I'll sometimes look at an LP(a) marker. And so LP(a) is another subset of the LDL family. And individuals with increased LP(a) have even more cardiovascular risk than just having standard LDL elevations. And so, again, our goal, and I keep stressing this, is looking at a holistic approach and really digging deep into the labs and making sure that we're looking at everything that we can affect, not just one thing. Our goal is to kind of create that holistic approach for our patients, and the best thing for that is knowledge. And so if we continue to look at lab work and continue to make sure that we're addressing every single possible lab value, every single possible thing that we can do to reduce risk for our patients, we're going to do that. So, once we kind of go through the lab work, if some of this stuff comes back abnormal, we'll start talking about imaging options. This gives us kind of a better picture of maybe what's going on in the heart and the arteries themselves. And so we'll kind of start with the CIMP marker. So carotid IMT here, carotid IMT measures the thickness of the carotid arteries, and it just kind of gives us an idea of maybe if there's plaque buildup, how much blockage we have. It gives us an idea of risk, and again, everything, as you'll see in this PowerPoint presentation here, is about risk. And so if we can check and make sure that everything's nice and clear, it'll help us to give us some ideas on your progression and where you are. And so something that I recommend at some point is typically doing a carotid IMT in our office. We do all our ultrasounds in office, and this is something that we can easily do in a span of 30 minutes to an hour. And again, just giving us more options to kind of check things. Specific data here to kind of support it. This data specifically showed about 10,000 patients followed for about 10 years, and really, carotid ultrasounds predicted about 98% of events. So it can absolutely be a helpful tool to make sure that we're covering all our bases there. But probably the most important scan that we typically do for patients is I send you guys off for a coronary calcium score. And so calcium, something that starts to build up in the artery walls due to the damage from the plaque buildup, and really this is probably one of the biggest factors for it, because as you know, calcium is hard as a rock. It's just like bone. And so as you start building up calcium in those arteries, you start narrowing those artery walls, and you end up having less room for blood flow to go through. It can cause blood pressure increases. It can cause increased chances for heart attacks and strokes. And of course, if it's happening in your heart, it's most likely happening in most of your vessels there. So it's something that's easy. It's $100 cash pay at BSA. The scan takes less than 10 seconds to complete, and it just gives us a good picture of your heart. And I kind of wanted to kind of show you guys what we're looking for. So as you see here, this is kind of a view of the heart that we'd see on a coronary calcium score. As you see, there's no white here. White is bright white on these exams, just like if you were to look at an x-ray of your bones. We're looking for that bright white picture. And as you see here, we can kind of start noticing some coronary calcium in this picture. And so that's our goal, is to try to see what exactly the arteries around your heart look like, and see if there's severe calcification there, something that we need to address. Now there are treatment options if you do have calcium in your arteries, some stuff that we do as well, but we'll talk about that in just a minute. But again, the goal is to see again, our best options to make sure that you're doing well. And so coronary calcium scores really do kind of go along with survival rates in terms of living a longer life. And so it's something that we check typically around the age of 55 or 60, or if lab work comes back abnormal. But as you see in this graphic here, we start noticing as the coronary calcium scores get higher and higher, follow-up time and survival rates just continue to get lower and lower. And so our goal is to halt the progression of calcium built up in your arteries. And again, the more education we know, the better. It's definitely not a test to scare you by any means, but definitely a test to kind of catch our attention and say maybe things need to make a change. And so these are two great options for imaging. They're quite easy to get done. The ultrasound and this coronary calcium score, just more tools in our repertoire there. So we're going to continue to kind of move into some treatment options here. And treatment options, of course, are there's a couple different ways we can look at it. So of course, kind of more of an integrative medicine approach. Less medicine is better. So we do our best to start with more of a supplemental approach, as well as a diet and exercise approach, to see if we can make changes there. We do use medications from time to time if we absolutely need them, and so we'll talk about some medication options. And then, of course, specific treatment specifically for coronary calcium score, plaque buildup in terms of IV therapies and whatnot. Let's see here. So starting out first, we're going to specifically talk about one direction there. We're going to talk about supplemental treatment options. And so, again, this is there's a lot of information on treatment options, specifically supplemental nutritional options. I'm going to kind of go over a few of my most important ones, but we'll kind of talk through what I think is important here. You may be on something different, which is completely fine, and there's just a vast amount of supplements that we can talk about. But we're going to go through these, at least the main ones that I tend to talk with most of my patients about. So, of course, we start first with just a niacin. Niacin's a vitamin B3, so it's something that it's really important for your body to have a good set of B vitamins, and so B3 is important as well. And there's been lots of research backing niacin and preventing maybe some of these cardiovascular issues in terms of cholesterol levels and reducing the chances of carotid plaque buildup and whatnot. And so really, niacin acts as like an antioxidant, anti-inflammatory type supplement. There's lots of good data on how important it is to make sure that this is where it needs to be, and really something that, again, it's a very safe, very effective way to kind of start off the process of this. This is probably my favorite supplement that I like to talk about with patients. Red yeast rice, especially with patients who have cholesterol issues, can be detrimental to cholesterol levels. And so the reason red yeast rice works so well is because it actually has the same active ingredient as statin medication. So that monocolin K, it's the same ingredient that's in statin medications, but it's just not as strong as it is in statin medications. But this works really well for patients, especially starting out treatment, or patients who can't tolerate statin medications. And so this is my go-to for my patients. If we ever talk about cholesterol issues with you in office, this is something that I'm going to bring up with you. Really, it's well tolerated. The side effect profile is very, very minimal. Most patients complain of stomach upset if that's something that's going to come up, but really, even I'd say probably less than 5 to 10% of patients have any side effects at all. And because of that, it's just a really, really great option. They've been doing studies on red yeast rice for years now. Specifically, this meta-analysis it was looking over about 22 different clinical trials. But the most recent research, even this past year, study of large amounts of population. I think there was about 5,000 people in the study. Every single patient saw a benefit, but most individuals saw at least about a 15 to 20% decrease in LDL cholesterol over the span of 6 to 8 months. Total cholesterol dropped, triglycerides dropped, total deaths dropped in these patients, so it's just a really great option to reduce cholesterol if that's something that if we kind of focus on these types of things, it's something that easily we can manage in our clinic. We can range the dosages and start to hopefully get some benefit from this as well. All right. Plant sterols are important. Examples of this might be something like dark chocolate. Dark chocolate's a great option to help with cholesterol. Green tea extract is another great option. So if you're drinking lots of coffee, maybe switching out one of those coffees for a green tea. Those are really good options. And plant sterols kind of have that anti-inflammatory approach. And what you'll see is most of these supplements that we talk about today, they do have that anti-inflammatory response that kind of helps them reduce that CRP. But also they help lots of other conditions, whether you're having issues with blood sugar or autoimmune issues. Some of these, they're all working simultaneously together to make sure that, again, we're not just affecting one thing. We're trying to approach a more holistic approach and trying to work with the whole patient and not just putting band-aids on things in specific areas. So plant sterols are a really good option. Fiber is a great option. There's lots of different types of fibers, fiber types, and so psyllium is probably one of the most common. But fiber has been shown to help with cholesterol. It's been shown to help with LDL, specifically triglycerides. It's also great for stomach health. It's also helpful for blood sugar issues. And so fiber is a great option, in terms of helping there. You also get good fiber sources through just great diet. So good variety of fruits and vegetables is a really great option to help make sure you're getting in that fiber content. All right. Omega-3 fish oils are really important for heart health. That's something, if you haven't seen us before, you might get sick of me talking to you about omega-3 fish oils. There's just research on research that discusses the importance of preventing heart attack and stroke with omega-3 fish oils. Fish oils do have a nice blood thinning. It's not significant like aspirin or anything like that, but it does have that ability. But it also helps just to decrease inflammation, decrease that CRP level. Can help reduce that oxidized LDL marker, all that stuff. And so something to think about. Typical dosages for omega-3 fish oil typically range between 2,000 and 3,000 milligrams a day, and so definitely something to consider. Berberine is another great option. It's an alkaloid present in plant roots. Again, most of these supplements have a variety of benefits for other conditions as well, but it can really help reduce cholesterol absorption. It helps with insulin resistance. It helps with fatty acid production. It helps with your stomach microbiome. It helps with carbohydrate absorption. There's just multiple benefits to berberine outside of cholesterol health, but specifically talking about cholesterol, it can really help to reduce some of those LDL cholesterol markers. It helps reduce total cholesterol, increase our HDL, which is really what we need. And so, in terms of all the supplements, you can do the same thing with supplements that you can do with medications. You can look up and you're on 20 different supplements and you're taking 25 different tablets every day and you're not sure what's working or what's not. So one thing at Willoff, what we did was kind of bring all these together into a supplement we call Lipolo. And so it is a fantastic option to help just give you one overall health, but also reduce specifically those cholesterol levels. And so as you see here, it has that niacin, it has red yeast rice, it has plant cereal extracts, it has garlic extract, bergamot and curcumin are great, berberine, CoQ10, grapeseed extract. It has green tea extract. So we tried to put everything into one supplement, so that way instead of spending money on 25 different things and taking them separately, maybe we could pile in some of these options and give you maybe an easier to take tablet. And so it's a great option. Again, we talk a lot about Lipolo and making sure that it's something that I always recommend to patients. And so it could be great for you. So if you have questions about Lipolo at some point, let's have a conversation about it, and maybe it might be a great option for you. All right. In terms of medication options in general, it can help, especially if we start noticing cardiovascular, so exercise and diet and supplements aren't helping. Sometimes we do need a little bit of aid with medication therapy. Now, of course, less medicine is better, and so we do our best to try to stay away from these the best we can. But in the end goal, our goal is to reduce our risk as we can over the lifespan. So sometimes we do need to add medications. And so starting from the left to the right, probably the most common therapy is statin therapy. Rosuvastatin, simvastatin, again, it has that active ingredient, monoline K. It helps to slow down the production of cholesterol in your liver, and it absolutely can help reduce those cholesterol levels. Now, there is an argument as to whether or not it helps reduce the LDL particle counts, if it helps reduce inflammation, if it helps to reduce stuff like myeloperoxidase and L-Plaque2, and if it really does help to reduce overall chances of heart attack and mortality. There's lots of different side effects sometimes with statin therapy, and so sometimes it doesn't work well for patients, but in very specific patients, it can really benefit. And so it's something that again, if we're not having benefits with diet and exercise, I'm not seeing the changes that I want to see. Definitely something to consider is statin therapy. It does work in terms of reducing cholesterol levels. So there's also other options. These other three are probably not as common, something that you may not have heard of, but cholesterol absorption inhibitors. Bioacids sequestrants are also something that it's not common practice to start with those, but you can. And then the last one of the PCSK9 inhibitors. Those are fairly new, and so they will. It's an injection option, and it absolutely will reduce your LDL cholesterol. But I don't have a ton of experience with PCSK9s with our clinic here, but I have had some friends who have written it for their patients elsewhere, and it can help there. So all good options. It just depends on where you are in your journey and where we need to get you. And so good options there. All right. One thing I did want to discuss specifically is once that coronary calcium score comes back, or that CIMT comes back, and we need to kind of address some of these plaque issues or coronary calcium issues. There are treatment options. Of course, we typically send you off to see cardiology to get a good workup with them as well. But IV therapy can be a really benefit to some of this. And so we talked specifically about EDTA. EDTA is an option IV therapy wise or orally. And how EDTA works is it actually helps to bind minerals and metals, and hopefully and effectively getting rid of elements in your bloodstream, and either reducing your coronary calcium levels or just keeping those levels at bay. Again, our approach is to try to stop the progression of this and stop the narrowing of the artery wall, and so EDTA can help with that, and it's something that we offer through IV therapy. We also carry some oral EDTA sometimes, and so it just depends on which route you want to go. Of course, IV therapy tends to work quite a bit better. Typical treatment periods are 15 to 30 sessions. We typically measure a coronary calcium score after those treatment options. PlaqueX is another great option. Sometimes we'll alternate EDTA and PlaqueX, but PlaqueX works by weakening plaque buildup in those arteries, so that HDL cholesterol can kind of transport that out of the wall. And so again, we alternate quite often EDTA and PlaqueX, so that way you get a good mixture of coverage. And so I wanted to bring up a few studies here. EDTA has been studied since the 1950s. It's an IV therapy specifically in the 1950s that really kind of showed up not on purpose. They were actually looking for ways to kind of pull out some lead toxicity in patients, and they started noticing, hey, maybe this might work to reduce chest pain. If that's the case, then what's the process here? So it's been going on since the 1950s here, and making those changes. As we move forward into the 1990s, we started seeing more patients and more studies being treated for this, and so there's a good amount of data that shows it absolutely can make a difference. In terms of specifically cardiac disease. So in this specific study, about 77% of people saw marked improvement in cardiac disease, just doing some EDTA chelation therapy. So again, continuing to move on and continuing to see studies. In this specific study here, about 80% of patients saw benefit. And so something to think about, something to consider, especially if your coronary calcium score comes back elevated. Something that we typically have a good conversation with in our appointments. Alrighty. Well, we're going to kind of move kind of forward here into probably the most important part of the presentation, and this is prevention. We like to say an ounce of prevention is worth a pound of cure, and so if we can prevent this process from starting, and then that's where we'll do our best there. And so finding the root cause of the problem and solving that root cause instead of just continuing to stick band-aids on things is what we do. And so first, of course, I'm not going to talk too much about routine labs, but prevention starts with lab work, and it starts with becoming a patient of ours and getting annual lab work done, so that way we can keep track of your health. We can also give you guys recommendations on lab work to look for, and as well as we'll talk a lot about diet and exercise here. But routine lab work is a good place to start. And then we start talking about diet. So food is your best medicine, and if we can really work on your diet and help you eliminate some of these foods that may be increasing your risks, that's where we're going to see a massive change. Again, we try our best to stay away from medication and focus on diet, exercise, nutrition, and this is one of the building blocks for that. So I always have patients ask, hey, what diet works best for overall health and cardiovascular health? And really, my answer, and I heard this from a podcast a few months ago, and I really liked the answer. And the answer was, the diet that works best for you is the diet that you can adhere to the most. And so finding plans whether it be food that you enjoy, foods diets that you can keep up with and not burn out so quickly, that's going to be the best diet for you. And typically patients see a good benefit from that. It's something that they can stay on and make sure that they're feeling great on the diet itself. But that's kind of my approach. Now, there are foods that specifically affect cholesterol, and so one of the biggest foods, markers or macros to follow, is saturated fats. Saturated fats are directly related to cholesterol levels, and so higher, having more higher content meats like beefs or pork, and it's really hard to say, but bacon. Hopefully, I don't get hit hard for that one, but I like bacon just like everybody else. But those types of saturated fats can easily increase your levels of cholesterol, so we have to be cautious of those. Butter, coconut oil, milk products are all high in saturated fat, and so again, it's our goal to try to help you maybe find those foods that may not work well for you, and doing some sort of food allergy testing, as well as helping you learn to track your food and your macros, so that way you can better understand maybe where some of these elevations in cholesterol come from. All right. Foods to eat, of course, foods that I'd recommend, in terms of anything else, is those monounsaturated fats. So that's like olive oil and peanut butter. Nuts are a great option for monounsaturated fats. So almonds, pecans, peanuts, pistachios, avocados, all those types of things. Green tea is a great option. Of course, garlic. If you like garlic, cook with garlic often. Make sure you continue to do that. It can be anything from cooking in your food to making it into a dressing of some kind. Garlic is a really great option to help with cholesterol. High fiber rich foods, flaxseed specifically, are a great option, but just a good variety of fruits and vegetables can keep those fiber levels up. And again, all these options are not just good for your heart health, but they're a good holistic approach in general. Okay. So with me, I'm always going to discuss exercise. I actually have a bachelor's in exercise science, and so I was a personal trainer for a few years, and been an athlete my whole life, and so it's something that I have passion for. And there's just a ton of research on exercise and longevity and cardiovascular health, and so with my patients, it's something that we're always going to talk about. And my goal for all my patients is 150 minutes a week of walking. Walking is really underrated, and really that's where you see a lot of benefit. And so if I could recommend one thing to start today, it's just start walking. And it doesn't have to be 30 minutes to 45 minutes your first session. It can be 2 minutes. It can be 3 minutes. Your goal should be that weekly 150 minutes, kind of putting those exercise minutes into a piggy bank. And setting a goal for yourself and reaching that goal. So if your goal for this week is 20 minutes of walking, that's great. Set that goal for yourself. Once you reach it, push that goal a little bit further. Maybe it's 21 minutes, maybe it's 30 minutes. But get out, open that door and get walking. All right. So specifically, the reason why I like walking is because it is a zone 2 for most people. It's a low intensity training. You should be doing about 90% of that with your exercise. That's where you're going to see a lot of benefit. And the rest of your exercise can be that high intensity training depending on where you are in your journey. So again, about 150 minutes a week of walking. If you want to increase some of that at the end of that week to maybe more high intensity training, that can only help, but focus more on anything, that low intensity heart rate training. That's where you're going to see a benefit. And so there are measurements that we can do in our clinic. And I think this is something that not a lot of patients know about. And so specifically VO2 max testing in general. VO2 max is a measurement of how well your body uses oxygen for exercise. And so this is actually a test that we offer at our clinic. Micah runs this test, and so it takes between 10 and 15 minutes depending on your fitness and where you are. And I don't want anyone to be afraid of this test. There's no reason to be worried that you're not going to look great if you can't make it for a very long time. I want to encourage you that we just want you guys to know we're right behind you and we're supporting you, and that's what's most important. And we want to help you get to where you want to be with your health goals. And so one of the great ways to do that is to test yourself with a VO2 max test. And so it's a walking test. It can be up to running. It just depends on what you, in terms of how you feel you're exerting yourself and how far you can push yourself. But it can easily be just a walking test. It can be a bike test if it needs to be. If you can't, if you have knee pain and whatnot, we can do it on the bike as well. But it's a really good marker for overall cardiovascular health and also just longevity in general. And I added a slide here at the end. There's a lot of information on the slide, but as we see kind of down here at the bottom, smoking, cardiovascular disease, diabetes, hypertension, all of these things increase our chances of all-cause mortality as we get older. But really, taking that VO2 max and increasing our VO2 max only shows benefits that's far out, exceeds sometimes diet changes that we make or medications that you could be on. Exercise is a key factor for making improvements and helping reduce your risks related to different conditions that you may have. And so, exercise is so important. And if there's anything that we can help you with in terms of exercise, if you have questions about that, we're always here for you. If you want to do testing, I really would recommend it. There's some clinics there's some major functional medicine doctors and also just traditional health doctors that I've seen online. They're all starting to move towards recommending VO2 max testing, and it's good. It's for a good reason. It can absolutely help overall health in general. So, kind of in conclusion, we're kind of coming up on the end of the presentation here. If there was 3 things I want you to take away from this, we talked a little bit about some of that stuff, but know your family history. So talk to your family and know your family history, what that looks like, and that's a huge factor for it. Come see us at least annually for an exam, as well as some lab work, especially at an early age, see if we can get on top of things. And then of course, with my background, I'm going to say, hey, exercise is key. So get out there, be active, get out in the sun, and continue to push yourself, set goals for yourself, and allow us to walk alongside you with those goals and improve your health in general. So I'm going to kind of come back over here. We're just going to have maybe some questions if somebody has some questions about anything specifically. I know we kind of rushed through that a little bit, but I wanted to make sure I tried to give you the best idea for that. So any questions you guys might have? Tricia, great to see you. I'm glad that you're here. It's been a little while since I've seen you, but it's great to see you. Kind of give you guys some time before we kind of end this presentation here and maybe answer some questions that you might have. Yeah, Jake, really good question. And so again, when we talk about the VO2 max testing, really it's measuring how well your body uses that oxygen as you're exercising, and so you need that oxygen to kind of get through your system, so that way you can exercise better. And so VO2 max, it kind of gives us an idea of how well you utilize oxygen. And one way that does that is when you do the testing, you actually wear a mask, and so you're breathing into you're actually breathing into a little device that we have while you're walking, and so it kind of measures how well you breathe, how well that oxygen is coming in and out of your system. And so it's a great indicator for just overall longevity in general. And so that's kind of the idea of what it is. There's been correlations between how well your body utilizes oxygen and heart health. Of course, that's how oxygen gets to your extremities, so that you can continue to move and exercise. And so by telling us, it kind of in relation gives us an idea of heart health. And so our goal is to make sure, again, that we're covering as much as many risks as we can, and so it just gives us a good option. So hopefully that answers your question about VO2 max. And if you're interested about it, that's something that I would really consider talking with Micah, and maybe it might be a really good option for you. Just make sure that you kind of discuss with us first, and before we kind of get you scheduled for that. Okay. All right, here. Madeline had a question about blood pressure. So low blood pressure can sometimes be something that's significant. Depends on how low it is. Of course, you want to check both sides of it. And so low blood pressure can make it difficult sometimes to exercise. Can also be an indicator for some heart issues in general. But that's where, again, we're looking at a whole picture. Typically, low blood pressure is better than high blood pressure, of course, but it absolutely can be something to be considered. We need to get a good workup on you. It just depends on how low that blood pressure is. All right. Christy, good question about yoga and those kind of legs up on the wall, stuff like that. So veins take blood back to your heart, and so the only way they do that is one, through gravity, or through muscle contraction. And so technically, yes, legs on the wall can help with some low blood pressure, but exercise is just as important for that. And so our benefit to helping that would just be to kind of increase contraction around those veins, increase that to kind of give us quicker blood flow. Of course, if you increase pressure in a pipe as your heart rate increases, it will help with that too. But it can help absolutely with low blood pressure. It can help maybe bring some of that blood back to your heart. But I kind of argue that there may be some better options as well. Just making sure exercise is an important part of your daily routine. All right. Let's see here. Let's see. I'm trying to see if anybody else has any questions. Carolyn, it's great to see you there. Glad you were here today. All right. Well, if there's any other questions, anything that you guys can think of, please reach out. Again, I'm so glad you guys joined me for this Saturday. There's so many other things you guys could have been doing on your Saturday, but it's great to see that you guys were here. And so please reach out to us if you have any questions. Please come see us. We want you guys to feel well taken care of. We want you guys to make sure know that we're walking right alongside you in whatever stage of life you're in. So if there's something that we can do for you, let us know. Otherwise, I'm going to go ahead and end this presentation. Hopefully we'll see you guys soon. All right.